pain is a huge problem. We, as a country, are using prescription painkillers and other kinds of medications at an alarming rate. The use of prescription painkillers has quadrupled in the past few years, even though the amount of pain has not increased.
The pain recovery program is for anyone who's been suffering from chronic pain and has been using narcotics or pain medicine chronically. And they want to do two things. One, they want to be off their pain medicine. And secondly, they want their pain to improve.
Believe it or not, we take pain patients on pain pills, we take them off of their pain pills, and their pain is reduced.
In 1986, my wife and I were in a head-on collision. My choice was to have my legs cut off above my knees into my thighs, live the rest of my life in a wheelchair, or become a drug addict. I achieved all my life goals by the time I was 62 by using pain pills. The pain pills stopped working about 2 years before I got sober. So I started chasing it with a little shot of rum to make the pills work better. And that worked for a while, but then I developed a condition, I don't remember the name of it, where if you touched me anywhere in my body, it hurt. My family said, look, you gotta go, because you don't know how bad you've become and how terrible it is to live with you and all that. I came in with 2 people helping me to walk, because I didn't want to bring a wheelchair in here, but that's what I'd been using for the past 2.5 years. 2 days later, pain level that had all my life, or all my adult life, had floated between 6 and 8s, sometimes with the pain pills. Woke up a couple of days later and it was a 4. Woke up 2 days later, no pain. And here we are, a week over 6 months from the day I left here, still no pain. No wheelchairs, no walkers, no nothing.
Oftentimes, addiction and dependence kind of get used interchangeably, and they're not interchangeable terms. Dependence can happen to anyone. Anyone who stays on a narcotic chronically, if that narcotic is abruptly stopped or the dose is abruptly lowered, they're going to experience withdrawal symptoms. Now, it doesn't mean they're an addict. Now, let's just say, on the other hand, that this person is getting prescriptions from multiple doctors. This person is taking the prescriptions in ways not prescribed by the doctor. This person is grinding up the medicine and snorting it through a straw. This person is forging prescriptions. That's addictive behavior. We recognize addiction as a disease. So they walk out of here with newfound sobriety as well as less pain.
I work as a nurse anesthetist. I couldn't wake up or do anything without, pain medicine, or pain basically ruled the way I looked at things. And one day while I was at work, I've been in CRNA for about 2 years. I had this thought to use Toradol, which is a non-narcotic, it's an NSAID. At that point, the next thing was to use other drugs. I was diverting from patients. I started leading a double life. And the next day I was at work, I couldn't control, and I was in the OR, and I was, without a lack of a better term, I was hijacked. I don't really remember what happened, and I lost consciousness. I woke up in the ER, and soon after that, I was given the option to go to treatment. But I realized very quickly that the park's what you make of it. I didn't want to do this again. I didn't want to go through this torment, bring my family and my loved ones through all this. So I gave 110%. Now I don't really have any pain. Pain that was aggravating so much where I couldn't think about anything else. All I thought about in the morning was, how's my pain gonna be? Now I wake up like, what pain? Because I don't obsess over it anymore. There's so many other things that you can put your mind to in a positive way.
My message of hope is that we have a treatment program that can help you relieve your chronic pain and lead you back to a hopeful and different and transformed life for you and your family. And you deserve it. You deserve to have the life you were given.
I walked in here delirious and out of touch with the world and didn't know nothing, couldn't take care of myself. All of a sudden I was functioning as a human being. And that's what I got from here. How do you thank somebody for that? You can't do it. You just accept it.
That first step in admitting that you need help is so huge. So if you think that you need help, if you think that you could use help, more than likely this place can offer something. And if you completely dedicate yourself to this place, it would give you more than you ever thought it would. It's just overwhelming how amazing your life is when you don't have to let pain lead it. You don't have to let a substance lead it.
Like our chaplain said, it's like watching Lazarus, the raising of Lazarus, that our patients are so transformed on our unit from where they came in when they finish that it is so dramatic. I just can't tell you, it's just amazing.